You're watching Ph.D TV. Knowledge is power.
Does a cancer patient have a higher risk of getting the coronavirus, COVID-19 infection than a non-cancer patient?
Yeah, I would say so. There's a couple different infection stages, two different infection stages of coronaviruses. You have your initial immune response, and that can release a lot of cytokines that can result in inflammation in the body and the joints and so on. And then typically people will respond to that. Now, if their T cells are busy or being inhibited by cancer, sometimes those immune cells, the same CD4 positive and CD8 effector and naive and memory cells that are fighting the cancers are going to be also being drained by the coronavirus, because one of the effects of coronavirus is it does cause a rapid death of CD4 and CD8 positive T cells in the regions of infection, the respiratory system. So I would say yes, and it could lead people with cancer having an infection with the coronavirus could create a higher chance of pneumonia and other acute respiratory
Correlated
infections. So definitely you want to be careful with that. Wash your hands a lot.
And when there's a vaccine, get it.
Yes, definitely.
Yeah, for sure. And on that note, I know that you recommend that folks with cancer make sure their vaccines are up to date in terms of flu and
you get the Pneumovax.
What do you want to say what that is?
Yes, Canada and the States, they're two different vaccines. I believe they've gone through a few different changes, so I can't keep up with them. It used to be Prevnar 13 and Prevnar 23, and then they called one of them in Canada the Pneumovax. Basically, if you Google Prevnar 13 and Prevnar 23, you'll see one of them is called the Pneumovax, and they work against a variety of different strains of drug-resistant pneumonia and encephalitis and so on. And these are just good treatments for anyone. They're good vaccines for anyone to have because you get protection against 13 and 23 different strains of diseases that are commonly killing people.
Yeah, and as a cancer patient, your immune system is a little compromised. So if there's a vaccine you can get that's just going to help stave off.
It's like free immunity.
Really wise.
It's like wearing a seatbelt when you drive.
Yeah.
Thank you for watching Ph.D TV. Subscribe below and stay informed.